Welcome, everyone. This is Pam Dunwald, one of your nurse advocates from Your Nurse Advocates Consulting. And we are here with another video in our series for our Senior Care Summit 2024. And we are excited to bring you Dr. Curtis Zachmeier. He's a chiropractor from Chiropractic First, which is a chiropractic office in Crescent, Minnesota. And we're really super excited. I think he has a lot of great things to share for our aging adults and how a chiropractor can assist them. So Dr. Zachmeier, we're really, really glad to have you. If you could just maybe tell us a little bit about you, and then we'll have you share your information.
Absolutely. Well, thanks for having me. First off, I'm excited to share a few tidbits from the chiropractic profession and just to share from my experience and especially for myself working a lot with the geriatric population and just the aging population that I've seen so many great results and have been able to feel really blessed that I've had the opportunity to work with that, keep people healthy, keep people active, and just continuing to do the activities that they love the most. So that's what I love seeing. A little bit about myself. I've been in practice for about 3 years now. I practiced for a couple of years in the Twin Cities, Minneapolis area. And from there, I've been here in Crescent, Minnesota for a little over a year practicing in a little more of a family style practice setting. I've really enjoyed my time here. I've gotten very busy in the last year. I've had a ton of great cases and great people to work with. So from my area of specialty, I focus more on the orthopedic side of things. I often work with imaging to assess the spine and take a very detailed assessment to look at how things are moving within the spine and other joints as well. And then we'll typically go through treatment recommendation and really just look at the patient's goals and decide what best interest they have in mind to accomplish. And we just start from day one and work to our best outcome to see what they're able to accomplish. So I really love this profession. My uncle is a chiropractor and he got me interested years ago. So I'm excited to just continue to serve and to give back and to also share from my experience as being a chiropractic patient first before being a doctor of chiropractic. So that's a little bit from me, and I look forward to going over some good stuff here. Should I just get started with that then?
Yep, absolutely, Dr. Zachmeier. Why don't you go ahead and start your presentation, and we'll get going.
Wonderful. Okay. So chiropractic for the aging population. We are all aging. It's something that just happens. There's certain things that we can do to help mitigate that in our best interest. The more that we can do to help in the preventative side of things within our healthcare, from the aspect of good nutrition, exercise, good practices of mobility and stretching, and those types of things, it makes for a better aging overall. And we live in a world that there's injuries, strains from work postures, and throughout a lifetime of challenges just against gravity. So the more things that we can implement from a standpoint of natural and really holistic style of practice in order to have the best outcomes over time, I have found has just been amazing. And the chiropractic profession has come a long way with that. And I'm excited to share a few things from that. So we'll go ahead and get started. We'll just go ahead and click through these here. There we go. Okay, so common thing, some people have a lot of knowledge of what chiropractor is. They've been using it their whole life, and others, they have really no clue what it is. Just to give a little background of chiropractic, chiropractic was founded just a little over 100 years ago. So it was 1895 where chiropractic was founded, and that was in Davenport, Iowa. Chiropractic was initially founded in the idea of using adjustments, or what are called manipulations, to adjust different parts of the spine, or to apply a pressure or a force into the spine in order to help realign the joints better so that they can move better, have less pain and discomfort, and ultimately function better. And so early on within chiropractic, there was the notion that by using these adjustments that we should be able to help realign the spine and have better health outcomes overall. These misalignments we commonly refer to as subluxations. Most people are familiar with a dislocation. That's where a joint completely comes out of the socket. That's a pretty traumatic injury, but there's what we call subluxations that occur on a daily basis from poor posture, from minor injuries, and sometimes even more significant injuries. And sometimes it can even just be a natural process of the body over time where the joints wear out a little bit more and things shift around. And without the correction of that, it can cause a lot of trouble for people with mobility and function over time. Chiropractic is really founded as well on the idea of improving joint function in order to help with the nervous system. So the nervous system starts in the brain, it goes down the spinal cord, and then out into the peripheral nerves, which go into the arms and legs, and really supply every bit of function within the body, from movement to sensation to overall organ function. So there are many things that chiropractors are able to help with from the standpoint of not only just pain, but also helping the nervous system function and the function of all the areas that the nerves go to ultimately if there is interference and irritation to those nerves, which is why chiropractic is very much considered a holistic art that in many cases can help with just the general health of people in a lot of ways. Over the last few decades, chiropractic has really come to the forefront and is evolving as one of the most popular alternative medicine options. I think, looking back decades ago, chiropractic was really considered, especially more outside the box. And, as much as some past history of chiropractic, somewhat was even considered quackery to a certain extent. And I think as time's come along, there's been more research and more understanding of the application of chiropractic and how it really is just a natural process of how your body moves. And it's necessary for your joints to articulate well, to move well in order for you to be well. So we're at the point now, in the last 20, 30 years, there's been a number of articles and literature published within chiropractic, and all that helps substantiate what we do, how it's effective, and ultimately why it's important and that the effectiveness is good for our population. So that's a little bit of history and background on chiropractic and what it is. Going forward here, so when we look at chiropractic of what is it effective for and what can it help out with, these are a list of some things that chiropractic is commonly known for being very effective for. And as I mentioned, along with that, there's a number of things that aren't on this list that have to do with just general health, that if there is a nerve pinch somewhere, wherever that nerve goes, there's going to be some lack of function. And if we can identify exactly where that nerve is irritated or the joint is irritated that's causing the trouble, we can really get to the source and really the foundation of what's occurring and what's the problem. So a couple pictures here of what is done with chiropractic and how it helps. These are a couple pictures of some adjustments or manipulations of the spine. And these are classically the most common forms of treatment that chiropractors use. So you can see here, there's one of the patient lying down. There's a manipulation or adjustment done to the mid-back area. And then from the other direction here, there's one of a patient seated where there's a neck adjustment. And these adjustments are typically applied in a very specific manner. There's many different ways of doing the adjustments, but the goal is to be very precise of where and what bone and what direction we're trying to correct that in order to make the best outcome. So a list of a few things that chiropractic helps with, and I'll get into a little bit more information on a few of these, but one of the ones I see the most often is arthritis, and really the cascade of what causes arthritis, which we'll get into. But commonly a lot of people go into an orthopedist or a different health group and they'll get some imaging done, or they'll even just get things assessed, and the prognosis will be, well, it looks like you have some arthritis. That may be a complicating factor. That may be a challenge to getting good outcomes or even reducing pain or dysfunction. So we see a lot of that, and we are able to help with a lot of it for not only a standpoint of helping aid with people that do have arthritis in joints, but also prevention. If we can get things corrected early on, the likelihood of a joint becoming arthritic is substantially decreased. Another thing that we see quite often is balance issues, and looking at just going up and down the list here, these are things that affect people from all walks of life and all ages, but especially throughout aging population, throughout life, a lot of these things become more challenging and they just become a little bit more complex. So going to next one in line, balance issues, such an important thing with our aging population, because we know from a vast amount of research that balance issues can be one of the most detrimental things to more aging population when it comes to falls. Some even broken hips can be very even fatal in some circumstances. So if we're able to, from our standpoint, from more of a holistic standpoint, try to work to improve those areas from earlier on and just continue to maintain good balance through life, it can drastically change the outcomes of people's health. So there are many things when it comes to the movement of our bodies, that if things are well lined up, you can really improve the balance, not only from a global standpoint, but also if people are shifted or tilted, or they have curves or other things that shift their body off to one side, that's going to greatly change how their movement is and how that can throw them off kilter and throw them off balance. So from our treatment, our goal is to try to get people straight moving as we can. And with that, that also encourages good motor patterns and good movement patterns in order to really reinforce that. So things stay well balanced and keeps people moving. Leads into the next one, movement disorders. It's one of the biggest challenges as people age, that they're not able to bend forward to grab things or move in different ways to really work around things in their environment. And if that's the case, that's going to lead to more injuries. It's going to lead to, once again, more falls or other things that can really be a detriment as we age. So the better we can get people moving, the flexibility, the overall pliability of their body and ability to adapt to things, the much lower chance there's going to be of substantial injuries on the musculoskeletal side of things. And that really keeps people functioning and moving better throughout time. The more that we see those stack up from one injury, one disorder, one movement dysfunction, as those things pile on top of each other, you end up in many people getting to a point where they're really immobile and sometimes can even become completely sedentary, which we know once again from plenty of research and literature, and also just from from my experience and others' experiences that have been around the health field, that is one of the biggest challenges when it comes to that standpoint of once somebody becomes sedentary, of how do we bridge that gap to get them moving again and getting functioning again. Next one on the list here, as I talked extensively about, nerve conditions is a major thing that chiropractors treat. About a day doesn't go by that I have some patient with what we term sciatica, or that's pain shooting down the legs. It doesn't always have to zing all the way down, but in some way, shape, or form, sciatica can affect pain radiating down into the legs or the hip or buttock area. There's similar conditions that affect the arms and go down into the arms. So as I mentioned with different nerve conditions, those are just some pinched nerve and peripheral nerve symptoms. A lot with that we see, often it's not only pain, but sometimes it's weakness. Sometimes it's abnormal coordination. Whenever there is a nerve pinched to an area, that's really the flow of information through those nerves of how to move, how to contract the muscles, the pain and perception, and overall feeling of those areas. So if somebody has a numb foot, they may not even feel kind of how they're moving around. If they have weakness in the leg, they may be limping, which affects other parts of the body. And then ultimately, if they have pain that's going down and shooting into their limbs, which is a very common thing that we see, people may have challenges sleeping or moving or sitting comfortably, and it can really be a challenge for people. And I think chiropractic is one of the best things that can help with that, along with physical therapy, other stretching and practices like that. There's many ways to help decompress the nerves, but first and foremost, I think by doing an adjustment, stretching, mobilization around those joints and where the source of the problem is around those nerves, it has a substantial benefit for people, and I see it every single day. Next thing that we often see is joint pain and inflammation. Inflammation is commonly very, very tied in with aging and with different conditions, not only from the joint level, but systemically. And the more that we can make an influence from that, from our standpoint of treatment, that can not only help joint function and joint pain, but systemically bring down inflammation, which is a benefit. Joint pain, which I'll get into a little bit more, is something that affects pretty much everybody. Whether it's your spine, your neck, your back, or other joints. I treat a lot of people for, which we'll get into the next list of things: shoulders, ankles, knees, hips, jaw pain, etc. There's pretty much any joint in the body can be, and in many cases will be, susceptible to some irritation over time. It's just a natural process that, once again, as I mentioned, through a lifetime of stresses and strains and just the force of gravity on your body, and as you're exercising and doing sports and work-related postures, there's so many things that can end up causing strain to those joints, which can ultimately cause irritation and inflammation that ultimately results in pain and dysfunction, which is a thing that chiropractic treatment can really help. It doesn't matter if it's a spinal joint or a shoulder joint or a knee joint. Every single joint has an optimal alignment, an optimal articulation of how it moves, and optimal function of how things are overall functioning in the system. So once again, if a trained chiropractor is able to identify those, not only if it's a segment in the spine, but also other joints, by doing an adjustment to help recorrect or correct that or recreate that optimal movement, that's going to be a great outcome when it comes to the function of that area. And what we see typically is that as things shift into a corrected position, that inflammation comes down, the movement gets better, and ultimately, even by getting more movement in that area, that helps compound the effects of the benefit that not only is it the swelling coming down, but the joint is actually starting to function again, and it starts to move some of that fluid out of there, and it starts to really create an opportunity for health in that joint again. So those are all things that chiropractic help with. I could go
And
on and on about different things.
Dr. Zachmeier, is that I've heard from some of the physical therapists I guess it's true that they say motion is lotion.
Absolutely. Motion is lotion, movement is medicine. Yeah, absolutely. And, I come from a background of mechanics in my family, which growing up, I really didn't fit in with me. But now that I work on bodies every day, I call myself uh, we go to the body shop today because that's what we're really doing. If you have a mechanical system that is breaking down, if there's gears that aren't turning right, if there's things that are wearing and tearing, whether it's on your car or your bike or whatever, there's going to be an effect of that, of improper movement and wear and tear that's going to show up. And the same thing really works within the body, that if things are moving correctly, if things are functioning well lubricated and optimally maintained, things can go for a long time. And a lot of people think, well, I've got bad knees because I've just been running my whole life. Well, if those knees were functioning and moving really optimally, you could get a lot more miles on those knees for sure. That's really a way that I look at it every day and try to, strive for not only my own body, but with everybody that I treat, and try to find the optimal balance and function of their joints. So moving on here, just even backing up on that last one, there was a list of things and I want to dive deeper into a few of them just because I think the implication and the impact is so important. And I believe so wholeheartedly that when applied correctly, the healing, medicine of musculoskeletal work within chiropractic, physical therapy, other modalities, there's so much prevention that can be done. And it's really hard to see sometimes when people come in and things are joints are worn out, and to a point where we're looking at going, as you're looking at this right side, we're looking at a knee view from the front, and you can see the clear difference in these two joints. And there are some patients that come in that have a knee that looks like the one on the right side there. And in some circumstances, I go, well, we can try our best. We can do what we can do. And at the end of the day, if it doesn't work for us, you can maybe look at other options. We can try physical therapy. We can try some other massage and other things too, just to try to help the system work the best. But at the end of the day, in some cases, sometimes people just need joint replacements, which is, we're thankful for that. We have a great orthopedic system within this country, that the amount of orthopedic surgeries that are done at this point are so high level, less invasive than they were in the past and last longer. So at the end of the day, we do have good options regardless, but I'd much rather catch somebody when they're on the left side there and be able to work through that and try to improve, function of that joint before it gets to a point where it's completely degenerated and needs to be replaced. Because that's a process in its own, and it's never easy or fun to go through a surgery. You just hope that on the other side things are working a lot better. So I just wanted to get into a little bit more about arthritis and
Yes. Dr. Zachmeier, could you just, for those that may not understand that, so the knee on the right, so that's what, when people are told maybe from an orthopedic surgeon or another provider, that would be what they would call like bone on bone. Is that what? So for those
absolutely.
that might not know exactly what the difference is, or why the one on the left looks better.
Absolutely. Yep. So, and I'll get into a couple things here with that, but absolutely, there's arthritis is one of the most popular terms thrown around within musculoskeletal care and within orthopedics. And I think generally it's definitely scary because we generally know that as we age, yes, we do get some arthritis. It's very rare that I see somebody in their 80s or 90s that they have zero arthritis. And a lot of it comes down to how they use their joints over their life. But sometimes that term is thrown around quite a bit, and one, there's many levels of it of arthritis. I, there's many different stages of the severity of it, and when it's just blanket stated as you have arthritis, people go, oh no, I think that must mean that the joint is broken down, it's not working anymore, and it's arthritic and it's dysfunctional. Whereas when we look at this right side, that is considered bone on bone, and you do hear that term, and it's just pretty plain and simple. There is between each joint, there's a space, there's an articulating surface that usually has cartilage or usually has some type of surface in between. And if things do wear and tear for a long time, it can wear that out completely, and then it can be considered bone on bone once that is completely worn out. And that's typically a point where surgery does occur. When we're talking about arthritis, there's a few different types of arthritis. What I want to stress on is what we'd consider on this right side. That's called osteoarthritis. And osteo is referred to commonly within the literature as just, it refers to bone conditions or relating to the bone. So it's arthritis of the bone, but not only that, but it's a form that is cascaded over time from wear and tear of that joint. There are other forms of arthritis that are more systemic or they're more genetic. If you hear the term rheumatoid arthritis, that's different from this generally. So this is just pure and simple wear and tear on the joint that results in arthritis, and that's termed osteoarthritis. One thing that we look at from the standpoint from chiropractic of our osteoarthritis is how do we, one, take a joint that is somewhat arthritic and help maintain that function for as long as possible, and second, can and how do we prevent osteoarthritis within joints? I'll get into a little bit more of what the mechanism is of chiropractic and how that occurs, that things can get injured and then cause arthritis down the road. We once again know from a lot of literature after certain types of injuries, the prevalence and chance of getting arthritis within joints drastically goes up. And there's a lot of theories behind that. And I think chiropractic has a pretty sound one. But as we're looking at the knees here, the one on the left, you can see there's a good space in between there, in between the two joints. The alignment, you can see it's pretty lined up, and on both sides, it has about an equal amount of space, and that's a healthy joint. On the right, you see that the space is pretty well diminished on both sides. You can even see on the inside of the knee, it's a little bit more smushed in there, and it's a little bit more collapsed on that side. And that's not only common within the knee, but we see it within the shoulders. We see it sometimes within ankle joints. And then certainly within the spine, we see quite often different parts of the spine. And I think the biggest takeaway is that just because you may have heard that you have arthritis, or you've spoken with an orthopedist and they say, well, you have some arthritis there, that may be why you have pain there, that doesn't always mean that it's going to be dysfunctional and pain forever. I see many patients that they say, well, I'm coming in, I've had imaging already, I have arthritis, so I know it's bad. And I take a look and I go, there's a lot we can do with this. There's a lot of patients I've had much worse than you that we've been able to get pain-free or darn near. So I think that's an important thing to keep in mind if that term has been used with you, that there's still a lot we can do. And even if I've even had people come in that say, well, it's bone on bone, there's nothing you can do. And sometimes there is, even in circumstances where it's pretty well bone on bone, that if we can get some movement in there and we can get you moving and walking and functioning better, that some people, they end up having dang near pain-free, which is amazing. Sometimes I look at some people's joints and I go, boy, I can't believe we got you pain-free, but that's amazing. I hope it stays forever. But like I said, there's always the option of great surgeries if need be. So even if it's bone on bone, even if it is advanced, we can find ways that we can communicate with other healthcare providers and find a way. And I think chiropractors are great entry-level providers in that sense, that we can look at x-rays. We're well trained to do that. We get plenty of training within our education. And from there, we can help decide, okay, should we directly refer you right away? Is it really needed right now? Or can we try to work with it and see what we can accomplish? And if not, then why don't we refer you then? And that way we can try to manage it from a conservative standpoint and see if there's some wiggle room literally for those joints. So yeah, that's our standpoint on arthritis and what we see quite often with that. Moving on, like I said, a couple things down that list that I think are just going to be beneficial. Touching again on balance and movement. We know that as we age, those things can be very much challenged. I see a lot of patients that have diminished balance. They can even, in the more severe senses, they can even have things like vertigo and other dizziness disorders that can obviously throw off your balance, and then can have a lot of challenges in that sense. And then ultimately, lack of movement is something that, as I mentioned before, it can lead to so many poor health outcomes, because we know how important exercise and function and movement is, even just daily walking. And if you get to a point where you're having challenges with that, it's really hard to get exercise and to stay healthy. So many of those things, if we can even correct from a standpoint of one of those things, it can really cascade to a lot of positive health outcomes instead of continued negative health outcomes from that. I mentioned already, the high association with falls and disability and even mortality. There's plenty of studies. If I had a little bit more time here, I would have posted a ton of different studies, but these are well-known things within literature and within healthcare that especially many studies that show after a fall, they increase chances of mortality or death within the next year, especially in the geriatric population, is really concerning. And if anybody has ever had a grandparent that they're concerned with, that a fall may be a very detrimental thing to their health, as I've had, that you worry about that, and you worry about them a lot, about getting around the house and just getting out and about. And from a standpoint of improving mobility of the joints and helping with balance from a number of standpoints, we can drastically make some good changes within chiropractic, which I love to see, because I love to see the most of just people being comfortable in their setting and in their environment, and not having to worry as much about fall, which is a scary thing. A couple of areas that can be causes of falls, as we mentioned, poor gait. That's a term that we use. Gait is referred to as your walking pattern or your movement pattern. And from a standpoint, I look at gait with almost every patient. I look at how they walk and how they're moving about. Even if they're just walking back to the treatment room, I take a look, and I can notice a few things right away. If they're hitching off to the side, or if they seem like they're tilted and going one way. A lot of those things can give us a lot of information about what we need to do to help them out with those conditions. So if you're off kilter or off balance before you even get going, the chances of you having a fall is greatly increased. Another thing is muscle weakness, and as I already mentioned, there's a number of things from a nerve standpoint that if there's a pinched nerve or an irritated nerve, that can cause muscle weakness in areas, and some people even have conditions that are called like drop foot, where they have an inability to fully lift up their leg or foot from weakness in a limb, and that can drastically change their movement, and ultimately can lead to tripping on things and falling. Another thing that I mentioned briefly was dizziness and vertigo. I see a number of patients with vertigo, and honestly, that's probably been one of the greatest areas of practice that I never would have thought that I would have been able to help with so substantially. There are people that come in here, and unfortunately, we have to help guide them back to the room, because they're disorientated and how they're able to perceive their everything around them from vertigo and from dizziness. And there's a number of things that can cause that. We don't have to get too deep into that, but a lot of it can come towards the neck and the face and the inner ear area. There's a lot of things like that can affect that. And ultimately, if we can find the right therapy and right treatment for that, people's lives can be changed. Because if you've ever known somebody with vertigo, it can happen in an instant, and it can be completely debilitating to where you don't know up from down. And that's a scary thing to go through, especially when you're in public, or if you're driving a vehicle, or if you've had episodes in the past and you have no idea when it's going to happen. So that's been one of the greatest outcomes I think I've seen in practice, where I've had dozens of patients that we've completely changed their outcome when it comes to their vertigo. And I think that a lot of patients come in and say, I have neck pain, or I have this or that. And then we ask questions, and it comes out that, yeah, I've been having episodes of vertigo in the past. And it's incredible that in many cases, we're able to completely resolve that by doing chiropractic treatment. So all those things relate to balance and movement, and how that it really affects, especially the aging population, and some of the most important things within their daily environment.
So Dr. Zachmeier, you might be addressing it later on, but I just had a question. When we're looking at before you mentioned movement disorders, and you're talking about poor gait, muscle weakness. A lot of illnesses or chronic diseases cause a lot of those things. So Parkinson's, multiple sclerosis. I mean, is chiropractic services, can that help, slow down or help improve or keep some of that? How does that play in with some of those chronic diseases that cause some of these things?
Absolutely, that's a great question. I have a number of patients that, for one reason or the other, end up in our office, and they have some complicating factors like that. They have MS or Parkinson's or other disorders that can be neurological in nature. And from my standpoint, especially when I was early on in practice, I was so blessed that I had some amazing mentors that would help me through those cases and share their experiences and help even co-manage. And I'm at a point now where I have a number of patients that have even been referred in for that. And really, what a lot of those conditions come down to, it can be a number of things. There can be a genetic component, there can be a systemic component, but ultimately, what we treat within chiropractic relates back to, as I mentioned, helping the nervous system function by treating the spine and the other joints that have nerves that pass in and around them as well. And ultimately, a lot of those conditions, they're underlying. They are something that have been ongoing. But if those are compounded by irritation to different nerves within the spine, it can ultimately add up to a point where it's really exacerbating the symptoms of the MS or the Parkinson's, to where I've had patients that have had, within Parkinson's, there's often, resting tremor or something shown within that even with adjustments before and after that, we've been able to reduce that. And I think it's just, once again, getting back to the holistic nature of the practice, that if we're able to supply the body with as much ability to heal and to adapt as possible, that we can take the load off of them, from a standpoint of, if there's a number of things that are compromising them, that it's just going to affect them systemically and can have a great outcome within those. In a lot of those cases, it's rare that we have a complete resolution, but usually not with medication or other forms of treatment as well. And a lot of it at that point is good management and from multiple aspects, but absolutely great outcomes with a lot of patients with that. And the more that we can help from our standpoint of affecting the joints and the nerves and the overall function of the nervous system, a lot of those things can be drastically reduced in the symptoms, which can change somebody's life ultimately. And once again, in a natural way, which is amazing. Great question, though.
Thank you.
Yeah, so I just want to get into a little bit more of, from a standpoint, chiropractic is very much known for neck and back pain, and especially just pain in general. It's one of the most effective ways in reducing pain that is natural, that isn't an anti-inflammatory or an over-the-counter medication. And I just want to get into very briefly what chiropractors really work with, and what you likely will hear if you go into a chiropractic office of what's communicated to you of what chiropractors are working with. So a little bit more on the pain relief side of things, and what causes joint pain, because it's so prevalent. I mean, I got some going on this week myself, and I just, you work through it, and I think it's something that some people have certainly more than others, and unfortunately, some are more have a predilection for it because of a number of different complicating factors, and others experience it their whole life. Some experience it more just as they age, but it's something that's unanimous amongst our population, and there's plenty of studies that show it's back pain is one of the most debilitating things to our healthcare system and also our workplace system, that it can be the biggest cost to our healthcare system because people are out of work, and they're unable to perform their jobs because they're in pain and dysfunction. So when we get into when we're looking at what causes joint pain, there's many different things, but certainly this is something we look at from a chiropractic perspective of what that looks like. So especially, this is a model within the spine, but this also occurs within any joint. And I already mentioned this term, but we work often with what we call subluxations, or a subluxated joint. And like I said before, when a joint is dislocated, if you think about a ball and socket of the shoulder, that joint comes completely out of the socket. And that's something you need to go to the emergency room for, and you need to get that taken care of, unless there's a trained physician or trained therapist that's able to reduce that. But we see every day our joint subluxations, and those are, if you think about it in the same aspect, looking at a ball and socket, if that joint shifts slightly within that socket, it's going to end up causing inflammation, wear and tear patterns, and ultimately it's going to cause some discomfort in that joint. And our goal is to try to identify how that joint is shifted in that socket or that alignment and apply a force to correct that. And as you can see from the model here, looking at the spine and what we see so much of spinal discomfort, spinal pain caused by the joints, it's something that most people experience at some point in their life. And so from what we see from this standpoint is, once again, there can be a trauma, a slip and a fall. There can be poor posture over time that ends up just leading to wear and tear that eventually gives out. It can be from a number of things. Even people, while they're sleeping, they can toss and turn and roll over, and they can wake up and they got a kinked neck, and something clearly shifted and something happened. And chiropractors, usually say, well, something went out of place or something went out of alignment. And there's some truth to that things do shift within the joints, and optimally, if we can get them corrected, it can help out a lot. So when we're looking at things here from this bottom picture of the subluxated joint, that misalignment can occur ever so slightly. We're talking millimeters of movement, and that can result in one, irritation, as you can see from the picture there, inflamed joint, so swelling at where the joints line up. It can cause inflammation around the disc, which is the cartilage in between the spacer within between the joints, the vertebra. And then if it gets bad enough, that disc can swell and it can irritate a nerve that exits the spine. And like I said, this can occur in other joints as well. There can be shoulder conditions that swell up and they irritate nerves that come down past the arm there, and it can go down the whole arm. There are a number of things that can occur within really any joints, but this is what chiropractors, our bread and butter, I guess, what we work with and chiropractors are historically known for, is identifying where those swollen joints are, where the swollen discs are at, and applying an adjustment to correct that, take pressure off that nerve, and to basically just allow that area to heal and for that swelling to come down and everything to start functioning properly again. So that's very common within our profession that we work with. And just to go down the list here, we see that swollen disc often. If it gets bad enough, it can even be herniated or can swell up so much that the disc can protrude back into where that nerve is at, and it can result in a lot of debilitation for people. Ultimately, it also can result over time as mechanical joint compression. So if something is shifted or it's compacted within that joint, over time, that wear and tear pattern of constant bombardment of that joint being out of alignment. We use the analogy all the time. If your car gets in a car accident and it's out of alignment, and then you go to drive it after that, it's going to wear and tear on the tires, and it's going to wear and tear on different parts of that vehicle because the pressure and the mechanics are throwing it in different areas, and very common within the spine that occurs in other joints as well. And if we can identify that as chiropractors and make a correction and get things healed and stabilized there, that joint can function fully again, and it can result in a lot of good outcomes in the future. Okay, so getting into a little bit more of frequently asked questions about chiropractic. This is basically my day one with a lot of patients that they come in, and some people, like I said, they have been to a chiropractor before. They've have chiropractors in the family. They're familiar with it. It's becoming more common to see things on YouTube or social media or videos like that show a little bit more, and people have a little bit more awareness of exactly what it is. But still, there's a lot of questions because there's a lot of different ways of practicing and doing things that people may not understand. And it's good just to ask questions. And I would encourage anybody, if they're going to chiropractor, just to ask a lot of questions and to get a full understanding of what they're trying to accomplish and their own health goals and interests in mind. So many questions that I see. First and foremost, is chiropractic safe, and is it safe for everyone? Chiropractic is widely safe. There's been many safety studies over time looking at large studies in populations. There are side effects as there are with anything, but anytime you're doing more of a natural process as chiropractic, where I even often I think after a long work day, I'm just thinking, boy, I just did all that work with just these things right here. There's a few other tools we use sometimes. Different technology comes out. There's many things that we use for adjunctive therapies to help, but for the most part, I'm pretty classic chiropractic, and I work with my hands of stretching and moving things, and it's pretty cool to be able to have a number of patients have great outcomes from literally just doing that. Nonetheless, there are side effects with any type of therapy or any type of treatment. For what we see most common is muscle soreness and aching. If somebody comes in with already irritated and swollen joint, if we go in there and we're thrusting and pushing on it to try to get it corrected, you're going to be probably pretty sore after. And I tell patients that before we even get started, that I think about it similar to like, workout soreness. If you go into the gym for the first time in 2 years and you're really throwing up those weights, you're going to feel it. And if we're moving things differently than they moved in a number of years, you're going to feel it as well. But for the most part, it's pretty manageable. It usually lasts a couple days, if anything, after the adjustments. And as we do more, things tend to go pretty smooth. So that's what I see most common. There are some more rare side effects that have come to the forefront within within general healthcare that, as we should be looking to see, are there major side effects of treatment and certain treatments particularly, and if they are, then how do we mitigate that, and how do we find better ways to do those treatments? And I would love to get into some of that as well. So chiropractic has been brought up at times associated with stroke, and that's certainly a concern if somebody's going in and getting treated. Is there adverse effects that could come of this, and is it for everyone? So looking at a study here that I posted, this is one that was a large study that looked at many different, basically a conglomeration of a number of studies called a case series that looked at a systematic review actually, and looked at a number of different populations that were reviewed using chiropractic care. And this was done in 2009, and that was kind of a point where chiropractic was really, people were wondering, should I go to a chiropractor? There's been a few studies out that say, it may be more associated with strokes, and this one showed one of the largest studies within chiropractic that there were 1.46 serious adverse events related to stroke for every 10 million manipulations. So that's pretty rare. From that standpoint, if you look at it from a statistical value, that is very rare. And ultimately, from my standpoint, and this is my opinion within chiropractic and within that as well, there are different ways to mitigate the risk of that. The way that we see it the most, and unfortunately in some circumstances it is a popular style of adjusting, is where the neck is adjusted by twisting it. And I don't practice in a way that uses aggressive adjustments in that fashion. But I think that's something, especially for the aging population, that they should look for and ask and try to seek that out. There are different techniques and different amounts of forces used within different techniques. And it's important to explore that, because as we age, all of our vessels and all of our arteries do have some form of deterioration. And especially if you're more of the geriatric population, I take very close consideration with that, and make sure that is, especially if there's been prior history of cardiovascular disease or other complicating factors, that I always take that into consideration and try to use the utmost respect for that patient and just safety. For whenever I'm treating the neck, or what's considered the cervical spine, for most of my adjustments, I do glides or tilts or shifts that don't involve rotation or spinning the neck or twisting or cranking the neck. I think some people get the idea of a bad, a ninja or kung fu movie where people are kind of spinning the neck like that. And sometimes there are videos out there of chiropractors doing that. And I think it's important to ask those questions and to look further into that before seeking chiropractic care. Is this chiropractor use aggressive techniques, or are they, look at their websites, look at if they do have a certain technique listed on their website within chiropractic, look into that a little bit more and see what that technique or methodology is about. Because there's different ways of approach for everybody, really, especially when it comes to people that have complicating factors. So in my opinion, to answer the question, I do believe chiropractic is safe for nearly everyone. There are some rare occasions, people with osteoporosis, sometimes we have to work around that. There are different things that we can use, such as there's little instruments that you can use that are called activators, and those just apply a little clicking force to the spine to apply a quick movement to the spine in a very controlled manner. I use that with patients that have more osteoporosis or bone density weakness. But I think when applied in the correct manner, I think there's something for everybody. Even there's some patients that come in that they're not getting great results with chiropractic adjustments. So what I'll do is come in and we'll start stretching and mobilizing things, and people get better often in that fashion as well. And if things start moving better to a way that it's not as painful, sometimes then we do progress to working with more adjustments or manipulations. But If ultimately, like I said, it comes down to really finding the right provider that is, open to that and open to different ways of approach, which to bring it up, it's sometimes a challenge because, it's hard to find the right provider sometimes. And there isn't as many specialties within chiropractic that have been established at this point that help guide and lead people in the right direction. So my best honest opinion, look up and down their website, see what they're about, ask other people that have gone to that clinic if you can, and do some research. If they do list some things on their website of what they do and how they practice, just try to look into those things a little bit more and see what therapies and what techniques those are all about. And that's my best point of, I guess, advice when it comes to, if you are interested in chiropractic, to try to find something that fits well for you at any age or complicating factors. Another question I get often is, does insurance cover chiropractic care? And since about the 80s, chiropractic has been included in a number of insurance networks. There's a variety of different allowances for coverage within different plans and within different networks of insurance, but majority do include chiropractic, and sometimes it's a little bit more limited or managed, but in many cases, sometimes 20 to 30 visits a year, which I think is amazing. If I can work with somebody's insurance and get that many visits in a year, we can accomplish a lot. And I think that's a great, launching point to, and if they need more, or if they need different care outside of chiropractic, we can at least, start with them and get an idea of what that looks like for them. So chiropractic is pretty widely accepted within most, insurance networks. And if you have any idea of which insurance that you're covered by, best thing you can do is just call an office and see if they take that insurance, and to you can even do a phone consultation with them to see, hey, do I have any idea how many visits I'd get covered, or this or that? And they can give you often a pretty general idea based on a number of people that have come through often with that same insurance, and give you a general idea that if they're going to be able to cover, a lot of your services, which is what health care and health insurance is really there for, to really help people in a way that they already pay for in certain aspects, and to take maximum benefit from that. And I love being able to work with patients with that, as much as sometimes it can be challenging to navigate with insurances. It's chiropractic is moving into a space that's pretty well covered in a lot of ways, which is great. On top of that, especially when looking at more of the aging population, Medicare, Medicaid is widely covered. There's certain times that in challenges, we're constantly trying to help bridge the gap to get more things covered, because that population that are under Medicare or Medicaid often very much are underserved and need chiropractic. So those are areas that chiropractic continues to lobby for and try to get more coverage under it. But generally, there's a pretty good spread that a lot of things can be covered, which is really good. For a lot of patients, I'd say most patients that come into my office, we get most of their services covered by their insurance, which is really great to see. And on top of that, there's HSAs and FSAs, which are different healthcare plans that you're able to use within chiropractic as a service. If you are able to get that through your workplace or other means, that those are widely accepted and can be greatly beneficial to overall outcomes of care as well. Another question I get quite often is, how long until I get relief or results with chiropractic treatment? And every case is different. I have some people that come in and, oh man, I threw out my back yesterday shoveling or something like that. And sometimes as simple as one adjustment, we're able to get things to shift right back to where they were and let them heal up. And, those are probably more of the rare cases, but it does happen, that chiropractic can be as effective as that, that without any type of anything else besides doing a thorough assessment and giving them one solid adjustment, that they're back to what they need to be. But for a number of these things, dysfunction and patterns of challenges within their musculoskeletal health and their joint health and overall health occur over a long period of time. So to reverse some of those things, it does sometimes take a number of visits. For a number of patients that I work with, often I'll recommend, sometimes a dozen visits over, a month or a couple month period, to really get a better understanding of how their joint is responding to chiropractic treatment. And if they're coming along real well and they're doing great, I'll usually say, well, you're doing awesome. We're gonna, we're gonna take a few weeks off here and see how you respond, and then come back and we'll resume then and see how you're doing. So it varies for every person. I just really recommend within chiropractic, really, once again, calling an office and seeing how they approach things, because there's been a number of different critiques within chiropractic of the way of approaching it. Do you just go visit by visit, or do you schedule out a whole big care plan and line it all up from there? And I think the best is somewhere in the middle, where you're really coming along with somebody and saying, hey, this is what I truly recommend. And I think if it was my mom or my brother or myself, of what it would likely take based on my knowledge and my experience. And is that something you'd be interested in? And along the way, let's do some check-ins and let's do some reassessments to see, is that where we're coming along, or do we need to modify things? And that's how I work with all my patients, and it really leads to great outcomes. You have to lead with love and lead with the end goal in mind, and you have to be upfront with people, because some people have had things going on for 20 to 30 years, and they come in and expect, well, just pop it back into place and send me on my way. And some things, they just take more time than that, and your body needs to adapt and correct from that. And if you want the optimal outcomes, then and if you're interested in pursuing that, chiropractic has many different treatment plans and designs, really for anybody, from the guy that wants to come in and, hey, just get me out of pain so I can get back to my job, to somebody that goes, I'm noticing I'm not moving as well as I used to. I'm noticing that I'm in more pain often, and towards the end of the day, or I'm waking up at night because of it. And how do I correct this? And I'm willing to do what it takes. So really just meeting people where they're at, and understanding that things can take a process, and ultimately, if you want long-term outcomes, that sometimes is the case with it. And we're willing to come right along with you and help you out with that. And that's a pretty good standard within the profession, which is great. Otherwise, looking at chiropractic treatment from the actual adjustment standpoint, or the treatment side of things, does chiropractic treatment hurt? For most people, it does feel great. Especially, I got adjusted this last week because I had a busy week, and I was adjusting a lot of people and working on people, and my upper back really started giving me a lot of trouble, and I couldn't wait to get adjusted. And that's I'm around it every day, so I know what it's like. But man, did it feel great when I got that adjusted. I could go back to laying down okay without having pain in my back, or adjusting and treating people without having discomfort. I had to step back and be the patient for a minute because I needed it. And for most people, it does feel great. I have to just, a caveat is, if you come in, as I mentioned a little before, if you come in with a swollen, irritated, flared up joint, and it's hard to move or even touch it, it's probably going to hurt a little bit to get on there and get a good solid adjustment on it. And sometimes it may be a process of, hey, today we're going to just work moving it a little bit, and we're going to have to come back later this week to see if we can really get on it, because it's so swollen, so irritated. You're going to jump off the table if I really, jump on this thing. So each person's a little different, but for most people that come in, that they've been having chronic stiffness or chronic pain, or something that's just cascaded over time, often I'll get a good adjustment, and they'll go, wow, oh my gosh, so much relief. Or people even come in and say, man, I got something jammed up here, and it just feels like it needs to be popped into place, or just, it needs to get moving again. And in a lot of cases, I'd say 90% of the time, it's immediate relief. And there's a lot of science behind that, of what exactly happens behind it. But ultimately, a lot of people get some really good relief from it. And I would just caution you, if you are in a lot of pain and something's really troubling you, to really just let your provider know that, and let them know, like, hey, I'm really struggling with this, and I'm a little nervous about getting it adjusted, because I don't want to be in more pain. And I think of it sometimes as like having a thorn in your toe or something, or in your hand. Is that sometimes the process of getting that thing out is not fun, but it feels a lot better after all that process is done. So you just have to be understanding where you're at in care, and just be upfront. And if you have concerns, just be open about that. And usually your provider will meet you with where you're at and try to find the best solution. So yeah, that basically covered those points there. Everybody's a little bit different, but for the most part, it's a lot of great relief that I see on a day-to-day basis, which is amazing. Another thing that is very, very common within chiropractic is X-rays. And there's a number of different imaging ways within healthcare that we're able to get more information, and not only just X-rays, but other diagnostic equipment and ways and tools. One thing that I use every day is digital full spine X-rays, and it's not every chiropractor that uses that, or even uses any form of X-ray. And the question is, are they helpful? Are they necessary? Are they detrimental in any way? And all those need to be asked and really looked at carefully, because whenever doing any type of imaging or other things, there's going to be some negative effects because you're using a very technical and highly advanced form of imaging, whether it's radiation from X-rays or from CAT scan, CT, or really any other forms. There's usually some way you're putting something unnatural towards the body, but it's for great reason and great use because you're able to get so much information that you're able to then apply to the patient individually and to really make a great health outcome. And I think without imaging and other tools, we'd be so far behind in what we're able to actually identify with the patient. I mean, you go into an ER and there's so many different bells and whistles of what you can do to get more information before they even touch you because they want to know for sure what's going on. And I can use my hands all I want to feel up and down the spine, different areas. But if I have a clear picture of what's going on there, I know so much more where to go from there. And I use it to really guide me. And I really call it my blueprint. As you can see from these pictures here, this is pretty standard of what we have with most patients, unless there's some contraindications or other complicating factors that we wouldn't want to get x-rays for them if they're pregnant or if there's other things that in their health history that would imply to not take those. But from here, we can see the balance of the pelvis. We can see if there's spinal curvatures. We can see from the side if there's a joint that's slipped forward or back within the spine. And I've applied this a lot to other joints, the shoulders, the knees, and other things that can really give me an understanding of how that joint is positioned in relationship to the rest of them. So I think from my personal opinion and just my experience, if you are considering chiropractic care, I would highly recommend to consider going to a chiropractor that uses X-ray because there's so much benefit that can be gained from it. And when looking at the radiation dose, what's great is as things have come to a more digital form of X-rays, and just even over the last couple decades, the amount of clarity within the X-rays with reducing the amount of actual X-ray radiation exposure has been amazing. So there's been, if you had an X-ray taken of you back in the 60s, let's say, you were definitely getting a lot more radiation, a lot more than you are getting today. And just like I said, from our standpoint of looking at, from what I do, the full spine X-rays to see how things are aligned and balanced, that when looking at a set of full spine X-rays here, that's about 2 times less than a chest CT, which is a pretty standard procedure. So it's really quite safe. Safety studies have shown that unless you're constantly repeating those, which I don't, and most chiropractors don't commonly repeat those unless there's a real absolute necessity, that it's a pretty low dosage to the point where it's not going to cause you any health challenges. And studies have shown that quite well. Another thing on top of that is there are patients every day that by taking these x-rays, I'm able to see some things that I would not have otherwise. So if there's every time I'm looking at the bone density to see, is this somebody that is going to be a good recipient of chiropractic adjustments, or is there a lack of bone density, especially within the aging population? Through each decade of life, there's loss of bone density in many cases. So to look at that and say, is this somebody that is going to be a well recipient of a firm adjustment, or do I need to scale that back or not at all? So that's very important to me. Another thing is if there's fractures or other complicating factors, there's a number of orthopedic conditions that we see that I otherwise would have never been able to diagnose without seeing an x-ray. So I am a huge advocate for it. And it's another recommendation for me that I would say if you're looking to seek a chiropractor, that's a good thing that, they're being thorough if they're looking at imaging, and something that, like I said, I use on a daily basis. So when wrapping this all up, looking at things from a standpoint, I know many people that come to our office, they're people that are looking at chiropractic as an option, that they're weighing out things and they're seeing, okay, one, have I had any experience myself in the past, or a family member has had experience or a positive outcome? Is it something that I could consider for myself that with my health background and health history, some people come in, they go, I don't even know if chiropractic is for me, but I'm in pain and I'm suffering, and can you help me? And if not, can you just tell me, please? And a lot of those people, we are able to find a way to help them. So this is a good checklist. I think that if you're considering chiropractic care, that you can certainly look at and say, if I can check off a few of these things, that it'd be a good idea to at least get a consultation with a chiropractor and to do some more research on it to see if it's something for you. So If you've had recent or reoccurring things within this category, I would highly recommend it. Neck pain, back pain, pelvic pain, at rest, or especially with activity. People have these things go on for years and years and years, and finally they go, enough's enough. I'm coming into the office here and I'm getting checked out. And so if you've had those things reoccurring over time and you haven't tried chiropractic treatment, if you've tried maybe physical therapy or other things, there's different ways of approaching it. And I would highly recommend that you go to chiropractor. If you have difficulty exercising or doing activities that you used to enjoy, or that you enjoy but you just can't do anymore, that's probably my favorite thing within practice, is going, hey, let's set a goal of getting back to doing yoga, or getting back to hiking, or skiing even, or something that is sometimes far out of people's mind that they'll ever be able to do again. And you take baby steps there, and those are the things that change people's lives, because they can get excitement back again to doing activities, and from there people can get really healthy, moving and exercising again. So if that's something I commonly hear over, oh man, I'm just getting too old to do that, or this or that. There may be some things like kickboxing, or more wild things as you age, that maybe back off on those. But most things, if you are able to maintain those things and you love doing them, and you can get good treatment to help out with those things, that more power to you.
Dr. Zachmeier, I was just thinking, I mean, that, to an aging adult, that could be the difference in whether or not they can maintain their independence and continue to age in place at home.
Absolutely. Yeah, that's a huge one. Huge. And yeah, there's many that they come in, and I like to say that my youngest patient right now is about 8 weeks old, and what we do is we just check her spine and make sure that there's no swelling around it. And if there is, we just do a little light pressure on that area. And then my oldest patient is 94, and from all spectrums in between. And yeah, especially as you get to the 80s, 90s, even into the hundreds, really all people want is to maintain that autonomy, maintain that ability to perform things on their own, and to, with as little help as possible, just go through their day with just on their own. It's a huge thing. And if you're able to start chipping away at a few of those things and say, okay, can we get you up and go for a walk a day? Can you stand in your kitchen for half an hour and make a meal? Can you even squat to get down to the toilet by yourself? I mean, those things are life changing. And if we can approach it one step at a time, and identify what's the limiting variable within that, absolutely, it can really change people's lives, especially in the later years, and really make a difference. Absolutely. Once again, we're getting back to the balance or movement dysfunction or difficulty. Whether it's bending down to touch your toes. I had a 25-year-old construction worker come in the other day, and he goes, my wife keeps giving me trouble because I can't bend down to tie my shoes anymore, and I'm 25. What the heck? And I said, well, there's probably something going on in how that low back is moving, and if we can get it moving, we can get you flexible again and get down there. And after a number of visits, he comes in, he goes, watch this. And he folds over, and he's like, I literally could not do this before. I can't believe it. And I did not want to go down that route already. So yeah, simple things like that to the most complex things. Balance, movement, it's important at all stages of life. If you have shooting pain into the arms or legs, as we discussed, those are the things that keep people up at night, and keep people from even sitting comfortably. Sometimes you see people, they're squirming around and they can't find any comfort, and it's miserable. I've been there. I literally have been, and I don't want to go back. So it's something that a lot of people deal with, and a lot of them just try to shoulder that and put it on their back, that I can just kind of push through this. And once again, chiropractic care has been shown very effective for that. Once again, if you have dysfunction in the knees, hips, shoulders, other what we consider the extremity joints outside of the spine, once again, not all chiropractors do treat those, but it's becoming more and more common. So if you look at people's websites within chiropractic, often they'll list if they do those types of things. And if you do have knee pain, a lot of people come in here and say, I plan on getting surgery in the next year, likely, and I wanted to see if chiropractic can help with that. And there's been many cases where we go for a long time without having to get that surgery, and we get people pretty darn pain-free, which is awesome. So if you have those other conditions, I just want to bring it to your awareness that chiropractic is very effective for that. If it's a joint and it moves, we're going to try to get her going. So yeah, look to see on websites and other forms of information that people have put out, that if that's something that they do within the chiropractic profession, because a lot are spine experts and they're spine specialists, and they may not focus on those other areas. And there's some that they build a practice. I mean, I feel like right now I could fill up my schedule with just knees and shoulder patients because it's so prevalent, and it leads to a lot of disability, which is why people want answers. So those are just a few things. Basically, if anything else relates to you, and that the rest of the last part, the rest of the entire presentation, consider a chiropractor. And a little bonus at the end, as we do in our office and pretty much any chiropractic office that I know of, if you just call them and say, hey, I'm a little nervous, I haven't seen a chiropractor before, I don't know if it's for me, ask to see, hey, do you think it's okay if I stop in and just speak with the doctor, speak with one of the staff members, and have just a complimentary consultation to see if it's right for me, or even if I'm a good candidate. And it's worth calling and asking that. And I'd say 9 out of 10 times or more, they'll say, absolutely, we'll make time for you on our schedule, and you can come right in and talk to the doctor, and he'll answer your questions, and you can see if you're a good person, good candidate to come in. And if not, they can hopefully even steer you in the right direction. So I'd say that's a great place to start if you're hesitant, or if you just aren't sure. To look around, see what's in your area, look at their website, and if something resonates with you, then to give them a call. And I'd even recommend checking out a couple potentially. We have some people that come in here and they said, well, you're the second or third place that I've come to, and I just really want results, and I want something that resonates with me, and I don't want to take up all your time, but I just want to see if this is a place for me. And I don't think there's a problem with that whatsoever. I think it's very important that you find somebody that works closely with you in a way that resonates with you. And whether it's at our office or any other office, if there's something that's beyond us, or it's a more specialty that we don't see as much, I hope to find the right place for you, because ultimately any great provider just wants to see the outcome and benefit of their patient and or their community. So that's a good bonus there that I would encourage anybody to do. And chiropractors are mostly in private practice settings, and they're very friendly and easygoing with that standpoint, that they're willing to share what they do and to see if it's something for you. So that is my checklist there. And ultimately, I hope that really helps, even if it helps one person to decide that chiropractic is beneficial for them and they get great outcomes from it. That's a big win for me, and I hope that it helps anybody that I can. So that is a conclusion of the presentation here. And yeah, that was a little long-winded on certain areas, but I really hope that answered a lot of questions within consideration of chiropractic, and just from our standpoint of what we do and what we're able to help with.
Absolutely. And, as a nurse, I've been a nurse for over 40 years. So 40 years ago, when I was nursing, it was, the question is, oh, I don't know, about a chiropractor, and it wasn't, what it is today. And I just want to say that Dr. Zachmeier, through your presentation, I think that you were able to share in a way where if anybody had any concerns about whether or not they should consider, a chiropractor for some of these things, I think you took away a lot of those objections. So I really appreciate your presentation and what you shared, because I think it really demonstrates the value that chiropractic service, can have with a chiropractic provider. So I want to thank you so much for taking the time today to be able to share this presentation. I think a lot of people will get extreme value, and I think a lot of people in the comfort of their own home, they can watch this video if they've ever had any concerns about whether or not a chiropractor might be right for them. Hopefully then this will be able to alleviate any of their fears so that they can reach out and seek chiropractic services. So Dr. Zachmeier, thank you so much. Thank you, everyone. We will see you at the next video for the Senior Care Summit 2024. Take care.
Yeah, thanks.